Larry, how do we avoid liability lawsuits and satisfy the FDA?
Well, uh, I already kind of went through this all just as far as my background, but it's a kind of a slide you throw in.
We know this. We want to know, where are you in that photograph? Why are you by a container ship?
Well, this is actually a 20-year-old photograph, so
I wasn't going to say anything.
the reason I put it on there is it was literally the best job I ever had. For 5 years, I was the director of the FDA import office in Los Angeles, and it happened that the FDA wanted to have a press conference to identify problems that the FDA was facing with companies trying to import things they shouldn't be importing, and so they set this out on the dock. This is actually outside my office in the parking lot, and behind are the container ships from the Los Angeles Container Harbor. As I understand, there aren't as many ships in there now as there should be, but nevertheless, it was an interesting job, and I learned a lot because that office regulates all FDA regulated products coming in from the Port of Los Angeles, which means from the Far East. So everything from the Far East came through there and saw all kinds of stuff.
Or Paul D'Souza has a thing or two to say about that, but please continue.
Okay, well, let's move on here. The first question I want to ask is, do you think about product liability lawsuits? Now, if you're saying, well, of course I do, then you're either a lawyer or you've had problems. Because I can tell you, in my 18 years in the industry, I never thought about product liability lawsuits. We were making good products, and they didn't always work perfect, but they worked pretty good all the time. And I never was deposed. Now, the reason I say that is that in expert witness cases I get now, many times for the company that's being challenged, the lawyers will depose the RAQA vice president or the director of QA and grill them on FDA compliance and issues, and then that's provided to me, the deposition, and I need to write my expert report. And what I address in my expert report is compliance with the FDA medical device regulations. And guess what? Sometimes those depositions from those officials in the company are very fruitful, and because the lawyers get them to talk about problems, and everybody has problems. So I think about product liability all now because I make money off of it. You shouldn't think about it if you're in a medical device firm, because you're thinking about number two. Now, that is what I thought about my entire working career. When I was with the FDA from 72 to 82, I learned the FDA rules. In 1976, the medical device amendments were passed, and I got trained on all the medical device amendments because of the job I had, an information job. And I took that knowledge and went into 82 into industry, and for the next 18 years, it was my job in the company to try and make sure that they didn't drift outside of the FDA compliance window. And I can say I must have did a great job because I never got involved in any lawsuits. Right now, that may not be true. Just your chance of getting a product liability lawsuit is directly related to how complicated and how risky your product is. Now,
I'm wondering, you set this up as if one or two. You're the expert or the expert. It's not that linear. Hey, I'm in compliance, but I got sued. I mean, that could still happen, right?
Well, theoretically, but what I'm going to talk about today is my view of FDA compliance from a product liability standpoint. And I can tell you with a high amount of confidence that if you do a really good job at the areas that I discussed today, your chances of getting sued are pretty minimal. It doesn't mean you can't. I mean, theoretically, a company could be in perfect compliance with the FDA. A product fails, because products do fail. Somebody gets dead or injured and they get sued. So in which case, my expert report won't be negative at all. And they probably won't use me in the case.
I could maybe think of 3 or 4 major medical device liability lawsuits. Everyone has heard of them. How many lawsuits are leveled against medical device companies per annum? Is it in the tens, hundreds, thousands?
I would say hundreds, because I get anywhere from 20 to 25 inquiries a year about cases on medical devices where there's an FDA issue on it. I don't always get those cases, but it's if you see the ads late at night on TV, hey, did you take
Have
this?
you been right? Call
Yeah.
Larry. All right, let's go to the next slide.
Okay. What we're going to talk about now are FDA compliance activities. And as I already mentioned, that they relate to product liability issues.
Yep,
And
got it.
We'll discuss that as we go through it. Okay, the number one thing that I'm talking about is design control, because I'll give you a story about a company that, in my opinion, did not follow good design control and now has a product liability suit where Larry Stevens is going to testify against him in court. And I'll tell you what that is. It's a neurological surgical instrument, okay? It's used in an MRI field, and the company included a metal component in the distal end of that product. And guess what happened? It got in the MRI field. In this particular patient, it heated up a lot and it damaged the brain. And my analysis of it was like, how in the world would you put a piece of metal in the end of a catheter that's going into an MRI field? I thought everybody knew. They always ask you if you're going to have an MRI. Do you have anything metal on? Do you have any implants on? Well, guess what they did? After they had the problems in the recall, they redesigned it and they took the metal component out. Okay. Now, my feeling, and the design control requires you to assess the area in which the hospital, your product's going to be used, and assure that it's compatible with everything else that's going to be used during the procedure, whether it's X-ray, MRI, angiographic fluid. There's a number of things, but depending on what your product is. So that design control, excuse me, the key is if you follow really, really good design control, the chances of having a problem are minimized a lot. And that's why I think FDA wrote the design control regulation that prior to that, a lot of recalls were related to design issues. And FDA says, we got to do something to stop that. We're going to write a regulation. Well, the first thing here I mentioned is risk analysis and risk mitigation. Okay. This is a common thing. The risk management is a common thing used in device companies because you have to use it. The key, though, is how in-depth is it? How well are you assessing all the potential risks of your product? Risk of the product itself, risk of the technique that's used to do it, risks of other things used in it, and doing that formal risk analysis. The FME is very common, where you assess the significance of the risk and the potential occurrence rates. And then you specifically then say, how can we get rid of those risks and do a risk mitigation? And I'm, for people who work in this all the time, this is, not innovative, but I know that it's something that companies aren't necessarily good at because they release the product with residual risks that were under-assessed, and those residual risks turn into problems. Okay.
I'd like to ask our audience, I think that's a great topic, to suggest who might give a talk, it may be you, Larry, how to de-risk your medical device before commercializing or something like that.
Okay, well, that I could talk about, but that's not really my expertise. A design engineer, someone who's worked in creating designs in the medical device environment and who manages risk in their company, oversees their risk problem. That would be the person that would be best to address something like that. Okay. And obviously very good information too. Yeah,
Daniel asked, maybe we have a panel, and I have to ask Daniel, the fact that he's here, no baby yet? We're gonna put him on. He expected a baby on Valentine's Day. I know this is a little off topic, ladies and gentlemen.
That's a risk. That's a risk.
We want to de-risk this pregnancy. Please go to the next slide in the meanwhile. Okay,
well, I want to talk about design changes, because this is the other area where I see exposure in mitigation.
Excuse me, this is important. No baby.
Okay. We had a false alarm yesterday, so we're close. We're getting close, Joe.
Are we gonna induce soon, or
next week? If it doesn't happen naturally by mid next week, yeah.
Okay.
Getting close.
All right.
Can't wait to post the picture on the chat.
Yes, we're looking forward to that.
Okay. Well,
Thanks for letting me
luck.
interrupt, Larry.
Being a parent is
Choice.
a wonderful responsibility and a big one to meet, and I know you're going to do a great job.
Oh, we're excited. Thank you.
Okay, design changes. Okay, when a company gets the product out on the market, they learn things that they really didn't know, even though they did maybe even a clinical trial, widespread use, and many times they need to address those with design changes. Okay, the problem I see is that the assessment of the need for the design change drags on over time. And I'll tell you a story about design changes. I went to work for a company that was, and this was when design control was really new, had a catheter they released, and it was a catheter that went over the wire. Well, they didn't really do a good assessment of the wires that were out there, and the wires with a diameter out of at the high end of the specification, and they had guide wire hangups. Not all guide wires. So what did they do? Well, they said, oh gosh, we got to quit selling that. It was newly released, so it wasn't really quote a recall. It was a stop sale, and they bumped up the inner they changed the design to bump up the inner diameter of the inner lumen so it would accommodate the wide wires. Well, guess what happened? They released that. Next complaint, slow balloon deflation, because that space between the inner lumen and the outer lumen was where the fluid went into, so it was an angioplasty balloon, obviously.
Mm-hmm.
Oh, okay, so those were design changes that were implemented without a full assessment. The question is, how do you make a design change? What are the requirements for it? Is it in your ECO? Excuse me, let me turn this off, please. Here.
Somebody needs your expertise.
That's actually a lawyer calling me, but
We should listen in on this. Answer the call. Let's see what's going on.
Oh, no, that's okay.
All right, there may be some liability in there. But you know what? I will say, I'm looking at who we have in our audience today, and there are a lot of people who could contribute. This could easily be a 2-hour conversation. So feeling a little anxious as your host, show me the PowerPoint arrangement where we see how many slides you have. And
okay, so wait.
I just want to get a sense of where we're going.
How much time do we have? I mean, I can finish this in 10 minutes if you want.
No. I'd say,
I could take another hour.
I know we could. Just,
I only have
I
7
see
slides.
Rick is on. I'm glad to see him. Design control. I'm sure Michelle has a lot to contribute. I'm sure, there's a lot of folks. Nellie, I'm sure. Before I start bringing people on, I
Okay,
just want to kind of get a sense.
So
How many slides do you have?
I have 7 slides.
Oh, okay. It looked like a bigger
Yeah,
thing.
that's what I'm saying. I can finish in 10 minutes.
No worries. Okay.
But you know me, I'm also a talker.
I do.
Okay, second area, complaint handling. We know that you're required to handle complaints, but the complaints is a key part of post-marketing surveillance. It's one that's been around a long time, but you have other ways now to perform post-marketing. And the key is, how do you analyze the complaints? Do you group them into categories? And do you trend those? The key is have an early warning of things that are going on out there. So if you need to take an action, you can take it quickly. The area in product liability suits that I've been involved in is companies we're getting complaints on the problem for quite a while. And I ask to see, as part of the discovery, show me, I want to see their complaint trending, and they don't have it. They would report complaints every month. They would say the complaints. Okay, so trending is huge. Root cause analysis. Now, the key is that at some point you should try on every complaint to determine what caused it. Now, is it the root cause? Who knows? But if it's attributed to something that is a design issue or a user error that perhaps can be fixed with changing the labeling, that needs to be linked to the root cause analysis. What do we need to do? And that default thing is the corrective actions. Taking corrective actions is easy if you don't have to consider other business aspects. I've worked in the company, and I know that as an RAQA vice president, I had to be sensitive to the other people in the company, like the marketing people, who weren't interested in FDA compliance. They were interested in customer sales and new products. Joe wasn't listening to that, was he?
No, I certainly am. I'm inviting someone who should be listening to this call.
Okay, so the complaint area is a huge area. It's one that the lawyers look at. What did you know about the product and problems, or when did you know? How did you analyze it? What did you do about it? And inevitably, I will see cases where problems existed for quite a while before the company, and there were problems that had a risk associated, a measurable risk associated with it. Okay, let's move on.
Actually, before you do, I want to ask you and the group, who do we know that we would recommend to perform root cause analyses? Because I've been better about keeping my live chat on, and I had it as late as this week. Somebody was just asking me about that, and I wasn't sure who to refer.
That's a topic you could spend an hour on.
I'm sure,
there's
but
all
I'm
kinds of
asking
different techniques.
who in our network do we trust to conduct an appropriate one? So if somebody wants to, okay, Eddie Lynn has a suggestion. An endodontist. What? Are you making a joke? I'm looking for the name of a human. Okay, please continue. If anyone has that, I'd be looking
All
forward
right.
to that.
Well, Joe, I'm glad I'm helping you out with future topics here.
You are. This is fantastic.
Thanks. Okay. The third
Ellie is
area.
good with root cause analyses, so we can keep her in mind.
Okay,
Please continue.
The third area of FDA compliance that I want to talk about are internal audits. Okay. Do companies do internal audits? Of course they do. You have to. You have to have an internal audit schedule. You have to have them done. You have to report them. But the question is, how effective are your internal audits? And that is the first thing I say. What are the qualifications of the auditors? Ideally, the person that's doing the auditing is highly technical and highly inquisitive. I would tell internal audits that work for me, you need to really get in there and dig deep and make sure you find any time people are not doing something they're supposed to be doing. But then I would tell them, but you have to be a part of the solution too. Since you work in a company, don't just be the problem finder. Be a part of the team that will give suggestions. And I say the problem is if you're not a part of the team that corrects problems, you're going to be eating lunch by yourself because nobody's going to want to be around you because they'll all hate the internal auditor because he gets them in trouble. So if you want to have people around you at your lunchtime, be an internal auditor that not only finds problems but solves problems. Okay, the audit schedule.
Would you say that as you were talking, I was thinking it'd be great to hire you to kind of come in and try to find a potential lawsuit. Is that in essence what an internal auditor does?
Oh, no, absolutely. You want to look at the complaints and you want to see if there's any trending there and if there's something that's a challenge on how, what are you doing about this? What's happening? What's your risk assessment here? What's your medical officer's opinion about this? I'll tell you a story about a medical officer in a real case. I was reviewing the depositions and they deposed. Well, no, excuse me. It was part of the discovery phase where they got a bunch of documents from the company. And one of the things I got was an email from the medical officer of the firm saying, and this company had product A, and they came up with the new design for product B that had advantages over product A. I don't know if it was cheaper to build or there was met a need that was, but anyway, they modified it and released product B. Okay, this medical officer says, I don't know why any of our customers are using product B. Product A was clearly a better performing and less problematic design, and product B is having many more problems. Well, product B was the one that the lawsuit was on. Okay, so I put in my report. The firm's own medical officer gave a medical opinion to the firm that they should not be selling the new design, but they kept on selling it. Okay, during my deposition, the opposing attorney, the one that's defending the company, says, Mr. Stevens, you said that the medical officer gave an assessment that perhaps the new design wasn't as safe as the old design. I said, yes, I said that. That's what he said in his email. Well, you understand that that's just an opinion and that he might not have had the right opinion. And also he was fairly new with the firm. Did you know that? And I'm thinking, yeah, he was honest. He's a new guy and gave an honest opinion. But the reason I was able, he said, well, what gives you the experience to comment on that? I said, I worked in companies. I was vice president of our, we had medical officers. I know what you use them for. For medical opinions. They're the medical expert and you listen to them. And if they say something like that guy said, you react to it, you do something, you just don't let it go. And okay, no more questions, Mr. Stevens. So that deposition went well. Okay, back to this. Audit schedule, don't overschedule. In other words, some companies say, well, we're gonna do an audit 1 month and we're gonna cover every area of the QSR in 1 month. If you have the resources to do that and the time it takes, because an audit takes away from the people doing the work, they have to show stuff. And so I would say don't overschedule, but schedule ones in the key areas, i.e. Design control. And the final thing I said is look to CAPA. CAPA is a great program, and I highly encourage companies to use it. The reason is it forces the company to do detailed analysis of problems and find root cause and design corrective actions and analyze the effectiveness of the corrective action. That process shouldn't be overused, but if you're complaint trending and you're seeing stuff going on, and you have internal audits that are finding stuff that's going on, putting those into a formal CAPA and getting them analyzed is something to do. And that there should be in the internal audit program and the complaint audits, the complaint procedure, links to CAPA, where you define at what level do you go into the CAPA system.
I brought Michelle on for 2 reasons. One, to promote your joint session at 10X, where the two of you plus Rob Packard are going to role play a pre-submission process, which I'm really looking forward to.
I get the easy part. I get to be FDA.
Is being FDA easy? But I also brought Michelle on because I was under the impression that CAPA was required. You have to have a CAPA system, not because the way you suggest, the way I heard you, Larry, was it sounded you should, as opposed to you must.
I misstated that. It's a regulatory requirement. Yes, it is. But it should be used effectively, not just exist. Some people overuse it.
It doesn't count if you never put one in it, and it doesn't count if you put them in it and never close it or take any actions.
Right.
Excellent point. Excellent point.
And this was maybe a year ago. I had a client who was in labeling, and they wanted to go to market and say, basically avoid a 483. You're going to get, labeling is going to doom you. You've got to get a labeling system. And I said, so if they get that kind of warning letter, what happens? Well, they have to this and they have to that. And I talked to Michelle and she said, yeah. And sometimes they say they're going to do it. They submit a plan to FDA. They don't. A few years pass. FDA audits again. Whatever happened to that CAPA? Oh, yeah, sorry, we never really. And it didn't seem to me, my recollection, that there was a real teeth to it, consequence for not going all the way through with a CAPA plan.
Well, there is a consequence. It's called a consent decree.
Yeah, I was like, that's exactly how you get a warning letter than a consent decree. Yeah.
Okay, well, thank you, Michelle. I'm looking forward to our discussion at the 10X meeting.
If you don't mind, I've also invited Nellie to come on. She said that this is exactly what happened to a client of hers. She, as most of you know, specializes in quality, and they had a CAPA and they never told her about it. So if she's able to come on, that'd be great. And here she is. Plus your anecdote real quick.
So I was hired by a company, and I asked, first thing you ask them is, do you have any 483s? And they're like, no. So I did my gap assessment, which I credit as an internal audit of what they need to do. And I found everything they needed, all the non-conformances, especially in complaints, not reporting them, not investigating them, not doing all those things. The FDA came to visit us. And then she goes, I want to discuss this 483. And I'm like, what 483? And during the inspection, she nails into it. And the good news was, because I had done my internal audit and found the same non-conformance, I was able to negotiate not getting a 483 and shutting the business down, because I was already correcting the issue and I had done a good internal audit. But I'm telling you, it was the most embarrassing situation I was ever in. On top of the fact that after the auditor went to lunch, the CEO comes, oh yeah, here's that non-conformance. It was in his drawer. Nothing had been done to it for 3 years.
Wow.
Wow.
One of my second job in industry, I was still in my like late 20s and, just young and eager and naive. And I got a promotion 3 months after working at the company to the regulatory affairs director, and from just being a quality engineer. And they said, congratulations on your promotion. Oh, by the way, we have a 6-year-old warning letter and import alert in the Tecate facility, 11 483s in Tucson, and we suspect the FDA is going to Nogales next. And we have a full ISO recertification audit in 4 months. Have fun.
That's every new regulatory person's nightmare.
Yeah. And the way that they got their warning letter was because they responded so bad that first off, they managed the audit badly. And so they had like a dozen 483s. They responded badly to the FDA, that basically they sent volumes and volumes of 3-page binders to the FDA saying the FDA was wrong. Then the FDA says, you know what? Don't call us. You just tell us when you're ready for a reinspection. We're no longer looking at any documentation you send because it's so bad. And here's your import alert. So every truck you cross, which was 3 a day for 6 years, will be held at the border.
There you go. There you go.
Yeah,
It's called import.
you probably were over some of that. Yeah, so it took me a year and a half of negotiating with the FDA to get them to even acknowledge that we were ready for them to come back and reinspect and close all that out.
War stories. I love them.
Yeah.
And Luke quickly wrote in that his company once had to raise a very minor complaint to be a preventive action just to show that their CAPA procedures were working properly.
Oh, used it. That's good.
Yeah.
Well, can I go to my next topic now? Because this is a hot one.
You may.
Recalls. Okay.
Recall.
This is an area of liability exposure, because when you have a product recall, and I always look at this when I look at a case, had they had recalls? How many recalls have they had over what time? Because to me, a recall represents a failure of something in the system. Now, whether it's a design issue, a production issue, something went wrong, and the key, I say, is you can avoid recalls. I fortunately, in my experience, 18 years, I can only think of 3 or 4 recalls with various companies I was involved in, because recalls are obviously not good for the company, and they stand as evidence that will be used in a liability case of system failures, documented system failures. So not good. So how do you avoid it? Good design control, and I put effective management of product issues. In other words, you do a really good design job. You put out a product out there that's got the risk mitigated and everything. But when product issues occur, you effectively manage those. And ideally, you can stay out of the recall issue. Now, I say the last item I put, what is the cause of the recall identified by FDA? That's something that when I, as an expert witness, I know. I can go to the FDA database and I can get copies of the FDA recall notice, and FDA always identifies a cause, a likely cause. And I've seen them in there where it says design issues. Bingo, FDA has even assessed their design control through the recall. So be aware of that whatever your problem is, it's going to be out there for the world to see in the FDA recall notice. Okay. Employee training. Okay. I love the automation of systems now, the integration of computer operated AI equipment in manufacturing, because if you can get the people out of the process, you reduce your chances for error immensely, because people make mistakes. That's just what they do. So the key is, how do you prevent employee errors? Well, one of the ways is by training people, certainly getting qualified people to do the work, but then giving them specific training. And FDA expects, and you should have, a training requirement defined for each employee involved in a regulated activity. So if you're a design engineer, these are the things that you're going to be trained in.
May I ask, how are these training programs set up? Are they just back pre-COVID, teacher in front of the room and have a conversation, or are these all automated now and you have to take tests and it has to be documented and such? And if so, what companies have those systems?
Okay, well, there are system, computer generated training programs out there that are being offered that help you define what the employees are, define the training form. It sends emails to people when the training's due. Many times the trainings are online where they have to go on independently. And as you mentioned, many times there's a post-training test that the employee has to take. And if they don't get it, then they do the training over. So I was doing an FDA audit at a company, and they had a really good training program. And I said to them, I got to tell you, you really spent a lot of, I can see you spent a lot of time on your training. This is when I went back to FDA in 2000, I'd been in the industry, so I kind of had a reason to say it. And he says, oh yeah, we had to do that. And I said, for FDA compliance? He says, no, not for FDA compliance. It's for OSHA and product and liability cases. I said, what do you mean? Well, we had a machine operator who was working and didn't set it up correctly, and it went off, and he was injured by it. And he filed a lawsuit against the company saying we did not train him adequately to be able to use that machine safely. And I thought to myself, okay, I thought they did it for FDA reasons. They were doing it to prevent injury lawsuits for their employees. It doesn't matter. Training is something that can help everywhere in a company, even training the sales force. Now, train them to sell? No. They know how to sell. That's their profession. Training on how to listen for problems and how to document it. Because the salespeople, the people out there with the users, many times are sources of what's going on. The doctors don't necessarily complain, but they'll say to them, oh yeah, I've been having problems lately with such and such. And the salesperson needs to be sensitized that needs to be reported. Because unless they're told, they think, okay, doc, well, I'll talk to some other doctors. Maybe I can get you some hints on how to use it better. I don't think they help out, and that's it. So key is that if you document effectiveness of training, how do you do that? Well, as Joe mentioned, you do post-training assessments, but also you use your internal audits. How often in the audits are you finding issues where people aren't trained adequately? Hopefully never. Hopefully everybody has a documented training program and they've been trained well, and whatever issues they're having is not because they weren't trained. Employers can happen with equipment failures, in other words, but we know there's preventive maintenance for that too. So anyway, I'm a big person on training. In electronic training is fine. It's better controlled than classroom training, although classroom training can work too. All right. Move on now. This is the last area of compliance I want to talk about. And why do I put it last? Because it's probably the most important. When I went back to FDA in 2000 and was doing QSIT inspections, quality system inspection technique, which was the quality system regulation inspection program, the first thing I would do is I would go in and I would say to the receptionist, hello, my name is Mr. Stevens. I'm an investigator with the FDA, and I'm here to do an inspection, and I'd like to speak to whoever's in charge of this facility. And they say, well, the director of vice president of RIQA is who we call. I said, no, that's fine, though, but do you have a CEO here? Yes, we do. I said, I need to speak to that person. Really? Yes. That's my first task is to, oh, okay. And I would go in, and the CEO would be there. Hello, how are you? I said, I'm an investigator with the FDA. I want to talk to you about your activities related to the quality systems in the company.
Now, this is one of those fabled FDA shows up at your door one day. You don't know it's going to happen.
Oh
right?
yeah, these are at least it used to be before COVID.
Right.
Unannounced inspections. You registered, you got inspected, you didn't know when.
It's funny. I've never been subject to it, of course. My visual of that is not Larry Stevens showing up, which feels far more ominous, like the FBI agents.
I was more dangerous because I was friendly, and people would tell me stuff that they shouldn't tell me. So anyway, the key is that if that CEO said to me, well, I'm actually the chief quality officer for the company. I have management reviews with my other senior officials, and we review various indicators of the quality systems, and we, as in part of our actions, we drive improvements. I get regular reports on complaints, and if I heard that from the CEO, I knew that inspection was probably going to go pretty well, because as the CEO goes, so goes the company. And I knew that because I'd been in the business world for 18 years, and the companies that were really compliant, I had active top management. The ones that had problems, the top management was more interested in sales numbers and product development than quality, and that showed too. So
I think you're saying that you saw a positive correlation between the functional expertise of the CEO and the likelihood of the product being safe.
absolutely, absolutely.
Wow.
The reason is
As a marketer, I take great offense.
as the CEO goes, so goes the company. If the CEO says, I'm concerned about those complaints that have been coming in, at our next meeting, I want to see a complete analysis of all those complaints and a report on how to do it. That's going to drive that function well. And fixing complaints quickly is good for the company. The CEO, well, bottom line is the CEOs need to know, and if you're an RAQA person, make sure they understand that they are legally responsible for any violations that occur in that company. The Food and Drug Act has what's called strict responsibility. You don't have to be actively managing it. If you're in charge, you're legally responsible. That's who gets the warning letter, the CEO, not the director of RAQA. So they can also be charged. There's the Parks case. If you want to do a little legal searching, there's a case called the Parks case, and Mr. Parks was the CEO of a big grocery company, and they had warehouses around that had lots of rats and contamination and all that, and the FDA filed an injunction and a personal action against Mr. Parks.
What year was this?
Oh gosh, that had to have been maybe in the 50s, maybe.
Oh my, okay.
Yeah, because I was taught about it in food and drug law when I was a youngster. But bottom line is, he had never been to any of those warehouses. He didn't know who was working in those warehouses. He had no idea what the sanitation practices were. And you'd say, well, how in the world would they charge him when he was not actually personally responsible for that? But the law, the food and drug law, is strict responsibility. The guy at the top is legally responsible. Why did they write the law like that? Why did Congress write that law like that? Because they knew what I just said. If the CEO is involved, your chances of your compliance are much higher. And if they're not involved, then we need to do something to make sure they get off. We'll hold them legally responsible. Okay. Management reviews. I think most of these have happened. You schedule them, you have an agenda. The key is I put quality indicators. There's the regular reports that come from each of the parts of the company that are being reviewed, and corrective actions. It's key that any corrective actions that are either decided or decided to be needed to look at should be documented as part of the management review. And the last one, as I said, link to that mandatory CAPA system that you must have. And the effective management reviews are really good for the company and really good for the RAQA department, because you get the respect from everybody because they know the CEO is interested in your work. And that's a good thing if you're working in RAQA.
I believe that was your last slide.
No, this is the last one.
Okay, because I have a whole bunch of people I want to bring on to talk.
Okay, well, I'll go through quickly. This is just a review. I picked out these 7 areas of compliance that show up in product liability lawsuits, in the sense of problems in these areas many times are associated with product problems that result in lawsuits. So that's why I picked them out. Next slide. If you want to talk to me more, my name, well, email address, fdadeviceexpert.com. When I established that domain, I was dreaming because I hadn't been an expert witness. So it was, and it's helped me in my expert witness work, because one of the admin people for one of the lawyers was working for us. I have a hard time keeping track of the expert witnesses and what they do, but every time I see your email address, I know which expert witness you are. So it's easy for me. And I said, well, thank you. I'm glad it worked.
There's a lesson there, you marketers out there and marketer wannabes. Okay, I'm going to ask you to go back 2 slides.
Okay.
Just for a moment, and soon we'll cut the slides entirely just so we can have a gallery of folks talking. I'm inviting Andre and Jorg and Rick and Shannon for starters. And I want these folks, of course, have different areas of expertise. Andre's expertise, of course, is sartorial splendor. Look at him with his beautiful necktie. Always comes to work appropriately dressed. Andre, as a contract manufacturer, you have, I imagine, had cases where there have been recalls or other things. How does the liability play when you have someone outside of the organization doing the manufacturing?
Well, first, let me knock on wood. We've never had a recall, so that's an important thing. And what Larry said, I think really the basic which we've always lived up to is that the FDA requirements are top of level. In fact, I'm really even though I'm president of the company, I'm the quality manager, and I think that it's a respected fact that the top level at the company are involved in every single inspection, every single CAPA gets closed out, and so forth. Now, however, no matter what, anybody can sue somebody anytime, and there have been cases where one of our customers that we contract manufacture were sued. However, they were able to get it dismissed. It only required us to supply some data. So Larry, what you talked about the design controls and complaint handling and so forth, they were able to determine that from our design controls that the complaint that was involved had nothing to do with the design of the product. So that was from our design history file showing that we addressed the risk and the risk was mitigated, and therefore that claim that was made was just a superfluous claim. So everything is, I agree with everything you said today.
Well, thank you. Well, let me make a comment. I work many times to defend companies. In other words, I work for the defendant. If they can show me why they think that they did everything right and that whatever problem occurred was handled correctly, and they show me that, then my expert report will say exactly that the company was, my appearance was operating full compliance, not full compliance, essential compliance,
Right.
And that many times those cases are thrown out.
Yes,
That's
exactly.
the key is if you get sued, you don't want to lose. You need to be able to defend yourself. Yep.
Well, you know what? There's an old saying, to keep the peace, prepare for war. So we look at all of the quality aspects like that.
There you go.
Josue, you had a question.
Yes. Hello, Larry. Hello, everyone. Basically, Larry, Mexico has become a manufacturing hub for medical devices, and over like 90% of our exports go to the US. So what would trigger, from your experience, visit from the FDA to these manufacturing facilities? And are they even visiting? Would the inspection be conducted in a different manner since it's a facility abroad? What can you tell us about that?
Okay, well, FDA has a foreign inspection program. When I was with FDA, I was in the device part of that and would go to foreign manufacturing sites. And in fact, if you're a foreign device manufacturer and you're doing it for a company that sells it under their label, if there is a recall that's related to a manufacturing problem, you can bet on an FDA visit at your site, okay? Because they'll go where the source is. Now with COVID, the foreign inspection program has suffered like all the programs. But I can tell you of a case that I was recently involved in where a product was refused entry into the United States because the foreign manufacturer, happened to be in Mexico, was not able to document compliance with Part 3. Well, it was 311. It was a drug case, but anyway. So what FDA did, they didn't go and do the inspection of the site. They said, you send us documentation of what you're doing to be in compliant with 311, and if you do that, we'll let the product into the country. But they whatever they provided, FDA didn't buy it, and they refused entry. So they're finding ways of enforcing the law now without even doing inspections, which they've had to do. But I think that's going to slowly reintegrate. So as a consultant, I had a job to go to Spain actually to do a pre-approval inspection of a device company that was making a delivery system for the US drug company who hired me. And I went in and I made some observations about process controls and what they were doing. And the QA guy says, he said, no auditors ever brought this up to us. And I said, well, so when I left, I said, I'm going to give you some help. So I had a closing meeting with the executives, and I said to them, first of all, thank you for this opportunity. I came in here and did an audit as though I were an FDA person. And I got to tell you, if I were an FDA person, I would write a report to recommend non-approval based on lack of process controls at your site. So if you're going to prepare for that FDA pre-inspection or pre-approval inspection, you'll need to address those really well. And the CEO's like, oh yeah, of course. Well, I have a huge friend now, that director of QA. He wrote to me afterwards saying, thank you so much. They needed to hear that. I've been talking to them about it. They wouldn't listen to me, but you did. I said, that's no problem. That's what I got paid for by the other company. And I'm glad I was able to help.
So Larry, you would be able to go to a manufacturing facility in Mexico and help them out with
yeah, well, I'm getting too old for that stuff now.
That stuff being what? Getting on a plane?
Well, no, being 8 hours a day auditing for 5 days in a row. That I used to do that when I first retired from FDA, but I retired 11 years ago. Most of my work now is desk work. So, but I can certainly give opinions if on stuff. But
Okay.
I'm not really ready to exert this old.
Michelle, that's a big part of your business, right? You have clients who hire you just for audits. Well, not just for, but you're on mute.
Yes, we do mock inspections regularly with FDA. And I actually used to work, well, obviously, Jose, you heard my story about working in the maquilas in Mexico. So I'm familiar with the culture and manufacturing operations there. But also, I used to work at a contract manufacturer after that one I told the horror story about. And I mean, we were audited just all the time, worked at a Baxter Healthcare facility. We were audited by CDRH and CBER and CDER, whatever, all of them. So I probably managed, 24 plus inspections on top of doing all inspections.
Paul, I brought you on just as I did Andre. I know that part of Extron's work is last mile manufacturing, as we call it, where you're assembling the product, you're in charge of the inventory, the logistics, getting it in and out, returns management and the like. I'm wondering, is your operation going to be subject to the same type of potential inspection as Andre's would or any manufacturers would?
I think it is. I'm pretty new to the company, but at some point since we are FDA certified as a contract manufacturer.
Well, if you're registered with FDA, if you filed your registration documents, that puts you on the inspection list. So
Yeah.
they consider you a manufacturer.
Yeah,
If
I
you're not a
believe they
manufacturer-
have come in. They have come in
Okay.
a couple of years ago. But listening to you today, because we're a contract manufacturer, listening to you today, I think it'll be worth us reviewing our protocols and practices and documentation and things like that. Michelle, we might have to have you come by and visit one day.
But let me ask, because your business is not exclusively medical device.
Correct.
So if FDA were to come in and he's doing some aerospace, some other industries, FDA would concentrate on just this part of the building? How would that work?
Yeah, actually, I can respond to that because we do make some products that are not medical device, and it's really just under the scope of the medical side. So the other, they're not looking at we treat the other products the same way because we don't want to have two quality systems, but they don't look at those products. They're not looking at a design history for a helicopter control that we make.
Right.
Well, yeah, and specifically for us, Joe, we've got production lines dedicated to the medical device companies, and then all the protocols related to those products. So that would be the scope limited to what because now we're building out a clean room, to a certain degree, the different levels of clean rooms. So we have dedicated, space for the medical device products, protocols, people, because we do the training. We do a lot of these things. I was taking copious notes, Larry, and but I think those the process, the internal audits, things like that, because as we make a push for more medical device products, I want to make sure that a lot of this is in place. It already is. We've been approved. We've had site visits over the last few years. I know we have, but I personally, I live on a ranch, but in New Mexico with the company Silicon Valley. But I think it's definitely what you've said today, Larry. I think suggests we really put the lights on and look a little deeper moving forward.
I have to call on Shannon next because she's moving all over her building and it is making
I
me
need my
busy.
morning tea.
Okay, well,
Well,
it was
hey,
for a good
like,
cause then.
I love this. Can you hear me? I love this talk. It's really getting me amped up because my company user-wise, we're ISO 1345 compliant, but we're not certified. And my goal for this year is to get certified. So I'm like, yeah, let's do it. But I just wanted to comment that I'm a human factors practitioner. I exclusively delve in the space of human factors and usability. And in 2006, there were only 6 recalls related to human factors and usability in the United States. But by 2011, it was up to 20. And I'm sure by today, there's about 40, just because of the culture of usability permeating industry and attention by the FDA. So this is an exciting and growing space for compliance. And the space where I see my clients fall down the most is just, or the most time I spend having conversations, educating them, is good documentation practices. If it's not documented, it didn't happen. And what I'm seeing is there's a lot of human factors practitioners out there that don't understand that, and they'll scribble their notes on pieces of paper that aren't saved, and then they write a report, and the report is the only record. Do you guys have any thoughts about that?
Anyone? Larry?
Or maybe
That's just classic, that if it's not documented, it didn't happen. And post-it note does not count as documentation. But that's industry-wide. But kind of on a side note, Shannon, I had put something in the chat that's indirectly related to usability, and that's that 21 CFR Part 30, 820.30 only mentions risk one time, but there are hundreds of pages of guidance documents and standards, and then they're like, you read the guidance like, oh, by the way, by risk, we also mean usability. And then that opens up another 600 pages of guidance and standards. And then FDA's classic for like, oh, what we meant to say when we said risk this one time was about 1,500 pages of implied content. So I really think that if there's a usability practitioner that is still documenting things by handwritten notes and that don't make it into the formal report, or worse yet, that are don't pre-approve acceptance criteria and whatnot, and then reverse engineer, oh yeah, that's fine, it worked fine.
This topic really brings out the South in you. I'm waiting for you to say, bless their hearts.
You know, the other thing is GDP in general, across the board, I don't care who it is, usability, engineering, even quality is a problem. I actually have a special quality training deck that I prefer to give live because I'm pretty animated on GDP, and I have a quiz that everybody takes, and I'm getting ready to roll out an annual retraining, because no matter how hard you try, everybody does it wrong, or they'll start doing it right and they'll start to migrate away from doing it right because they got away with it and somebody didn't catch them. So, I mean,
Nellie, you have to cancel whatever May plans you have. I know you can't come to 10X, but just move everything around.
hey, you play my fight and I'll figure a way.
Okay, we can talk about that offline.
No, but just, you know, to me, I'm very passionate about GDP, and I'm actually,
Me too.
matter of fact, when people do it wrong, they're like, ooh, don't let Nellie see it because you'll go through retraining. I literally had somebody use a purple pen 24 hours after I gave GDP training. They use a purple pen to sign my training record for GDP.
I would lose my mind.
Okay,
I
so
did lose my mind.
hold on, what? Why is that a big problem? The color of the ink?
It's preferred, and most GDP procedures say black and blue.
Okay, but I'm not going to GDP jail because I used a red pen.
You'll go into my
I'll send you
GDP
to
jail.
GDP. Yeah.
Okay, well, I don't
Well,
want to do
the
that.
thing about, here's the thing about GDP is it's not a regulation. There's no regulation that says you have to use a purple pen. And that also makes it really difficult for me to have these conversations. There's nothing to hang my hat on, like, yeah, you can't use a purple pen, but
This is silly. This part is
it
seems silly
sounds
to me
silly,
and
but
very,
it's
very
not.
what
arbitrary.
industry
It's
does.
not. It's industry.
And everyone has to do it.
So what I get around with, Shannon, is my quality training deck is released as the official GDP guide. So then what I say is, yes, there's no regulation, but we have an internal procedure and you're non-compliant to the internal procedure.
Okay.
Yeah, that's what
Rick, I
everyone
needed
does.
to have you on
Like
this.
back in the day, I worked at companies where it was only blue ink for a long time because
Yeah.
copy machines were only black ink. And so if you signed in blue ink, that you knew that it was not a photocopied signature. But then they started making copy machines.
That is still our procedure. We have only blue ink.
I am very surprised that we spent 2 minutes on the color of ink. Rick,
Still
I have to
won't
bring
write
you
with a
on.
black ink.
Ladies and
still
It's
gentlemen,
won't-
important to all of us.
ladies and gentlemen, as your moderator, may I please draw your attention to the center square? Rick Stockton, I brought you on because we're talking about design controls, and you're the guy I think of when it comes to design for manufacturability and design controls and the like. You wrote a generous tone in the chat. can you, as best you can, my loquacious friend, summarize for us points that we need to take away as it relates to Larry's talk today?
Well, one thing that I'm an engineer or designer, that's kind of what I do, and I'm lots of process experience. But if you looked at my personal training schedule, who I sit in on, who I listen to, and things like that, I've listened to Michelle's presentations, lots of Rob's, and things like that. And so when they send things out, I listen to them and they go, why in the world? Your job is designing, your job is creating all this stuff and processes. And well, I have had the things that I learned on one of these presentations actually affect the way I design something because of the different impact that it would have on how hard it would be to get this thing through the regulatory process or to get a change through the process. So whoever you are, even if you're doing something like, well, I'm in engineering, it doesn't matter. I'm just going to, I'll just let the quality people do the quality thing, and, I'll let the engineering people do the engineering thing. Well, that's great if you're not working in medical or anything else that's regulated. But if you are, oh, geez, you're going to be so sad before too long if you don't have a familiarity, so when to get them to throw you, hey, throw me a life jacket. This is getting into technical stuff, and I don't want to get my customer into trouble. So, it's a neat deal.
As I mentioned earlier, I've been better about keeping my live chat on, and that works for medicaldevicesgroup.net and for medicaldeviceevents.com for the conference. And, I'm thinking about the kinds of conversations I've had this week alone with people who have a medical device idea. And I'm thinking the panel of people on this call right now, they would just scare the bejesus out of these people if they knew all of the things that needed to happen, starting with the strong arm of the law, Mr. Larry Stevens, our guest speaker today. So thank you very much for that.
So Joe, what I had was a Larry question.
Yes, please.
And it was in terms of root cause. If you've got some kind of a problem and you're looking for root cause analysis, what are the things that you look for? My guess was you'd go to somebody, if it was an electrical thing, you'd go to somebody with experience in that, mechanical, coding, documentation, all those kind of things. And in general, toward the bottom of my comment, I wrote that you'd look for somebody with expertise in process, with a good familiarity with the regulatory world and things like this, and also a significant degree of communication and cross-functional capability. So Larry, my question for you is, when you're looking for someone, have I missed anything? Good chance I have. What do you look for in terms of finding somebody who's your person who you want to go find for root cause analysis on a problem?
Well, again, as an auditor, one of the things that I'm glad you mentioned root cause, because there's nowhere in the regulations that say root cause. But if you do not have in your CAPA program a requirement that the product be assessed on a root cause determination and identify what tools you're going to do, the FDA will write you up on it. That's one of those unwritten regulations. So the key for me in root cause is, obviously the person who has to do the root cause analysis has to come up with the root cause. Yeah. And how do you know it's the root cause and not a contributing cause? Well, the general way to know is you make the correction and the problem goes away. You fix the root cause and the problem's fixed. If the cause that you identify as the root cause and you implement it and you're still having problems, then it wasn't the root cause. So I don't have to personally assess how accurate the root cause analysis was. What I can assess is, was it effective in eliminating the problem? And that's the key for me.
To be continued live in person, San Diego, May 10th through the 12th. I look forward to seeing most of you there. Yeah. Nellie Bushman.
Right. Well, thank you.
Andre Domino. What is that, an anniversary thing? 40, 41?
41.
Because the 40th was canceled. You were going to do a big thing with COVID. And where are you guys going?
Just down the shore, that's all.
I was expecting you to say Italy, I swear.
No.
Say Italy.
Not yet.
Okay. Thank you, everyone. Larry, special thanks. See you all
pleasure.
next week. Okay.
Ciao.
Bye.
Bye.